Hi everyone, so it's September, it's Thyroid Cancer Awareness Month, and I wanted to make a video and show you how to check your thyroid. So your thyroid is the butterfly-shaped gland in the front of your neck. Thyroid cancer is the 5th most common cancer in women, and it's typically diagnosed between the ages of 15 and 29. So I was diagnosed at 27 with papillary carcinoma. So that cancer is typically caused by radiation exposure. There can be some cases where it's genetic, and it's a mutation of a gene, but for the most part, it's caused by radiation exposure. So something I want you to stop doing to yourself and to other people is playing the cancer blame game, I call it. So right away, the first thing I did was, oh my gosh, when I found out I had cancer, what did I do wrong? So you didn't do anything wrong. It's not your fault. It's unfortunately just something that can happen, but it's not like anything that was caused by lifestyle choices or anything like that. So I always worked out. I always took care of myself, ate healthy. But unfortunately, at some point in my life, I was probably exposed to radiation. It's really important when you're getting x-rays or your dental checkups, your dental x-rays, ask for a thyroid bib and cover your thyroid because it's very sensitive and it's right there at the base of your neck. What else? So let's get into how to check your neck, okay? Okay, so I'm going to show you how to check your neck. I'm not a doctor, I'm just a patient. I'm sharing my experience with you and how you can be proactive with your health. So if you want to check your thyroid, you're going to put your finger on your chin, okay? And then work your way down until you feel like a pointy bone. That's the beginning of your thyroid cartilage. And then you're going to go down until that bony area ends and you're going to feel like your membrane down here. So a good marker for you, you can see my scar right there where I had my surgery. That's going to be a good marker to show you like the area of the thyroid. It's going to be underneath your voice box and above your collarbone. That's the area you're looking at. And you're going to take your 2 fingers and you're going to move back and forth and just feel that area. It's a butterfly-shaped gland, and you're going to feel for any lumpy, bumpy areas, okay? And then you can also take it and spread it apart so you can get a visual and swallow. And it will move up and down. I don't have one, so you're just going to see like my voice box move up and down, but this, you'll see a little area move up and down when you swallow because you'll have a thyroid. So that's one way, and then you can feel. You feel if you feel anything like sticking out, any lumps. And then another thing you can do is lean your head back in the mirror and take a sip of water and watch that same area. Once you get a feel for where it is, see if you can visually see any lumps. Now, just because you can feel one doesn't mean you'll see one, and just because you see one doesn't mean so it's important to do both. They're not always visual. They're not always going to be large enough to see them, but you'll be able to feel some bumps. And if you do feel something, don't panic. The point of this video is not to cause anyone anxiety or panic, but to be proactive. So if you feel something, make an appointment with your primary or your ENT or your endocrinologist and just point it out to them. I felt a lump. Can you feel my thyroid? Or if you feel something that's concerning, if it hurts, you can ask them, for an ultrasound. That is the next step if there's something that is concerning on your thyroid would be an ultrasound. Okay, so I want to talk about some things that made a difference for me on my journey and I think helped me a lot, was having an endocrine surgeon. So when I first started out, when I was first diagnosed, I was at an ENT. I actually pointed to the lump on my thyroid and I said, "What is this? It hurts." And he felt it and he's like, "I really don't think it's anything, but we'll order an ultrasound." From there, obviously, the ultrasound was questionable. So we did a biopsy, which is a needle that goes into your neck. It's not the most pleasant experience. And from the biopsy, it came back that it was papillary carcinoma. So when I went back, obviously I needed to have something called a thyroidectomy, which is when they remove your thyroid. So it's a total thyroidectomy. They remove the whole thyroid so that there's no chance of it. It lessens the chance of it coming back. Well, that surgery would have been based off of that ultrasound and as well as the biopsy, and at that point they were telling me that it had not spread. They didn't see any questionable lymph nodes. My mother being my mother, she wanted someone who just did thyroidectomies. Like, she wanted someone who, that's all they did. So we found an endocrine surgeon, and that's all she did, was remove thyroids. And, you know, obviously heavily, it was thyroid cancer was her specialty. So when I went to her, the difference was she did the ultrasound. She did her own ultrasound. She didn't want to rely. She said, I won't even look at whatever the tech did. I want to see this for myself. So as soon as she did the ultrasound, she found 2 lymph nodes that she found super questionable. And as it turns out, when I had my surgery, they removed 7 lymph nodes from my neck, and 2 of them were affected. The cancer had spread regionally to those lymph nodes. Now, that's critical, because if I had had that surgery and they had left lymph nodes with cancer in them, obviously it would have continued to spread throughout my body. So that was huge to me. Really, really make sure whoever your surgeon is, you know, they're on top of checking that area and making sure there's nothing else affected. That's not to say that the other surgeon wouldn't have been able to see it once they were, you know, in surgery, see that there were some questionable lymph nodes. But for me, just the fact that she spotted them on her own ultrasound was huge. The other thing that you'll have difference with surgeons, an endocrine surgeon, you will not leave surgery with a drain in your neck. You will have internal stitches, and then your bandage will come off, and there's no removing of a drain. You never have a drain. If you have an ENT do your surgery, you will have a drain, or at least when I was having my surgery done, that was the case. They were using drains, and it was this thing they had to pull out of your neck. It looked awful, and I've heard from some other patients that it was like the worst part of surgery, and I didn't have that. So endocrine surgeon was huge for me. And again, this is my experience. Everyone has different experiences. Also, I use Synthroid. I've always used it. My endocrinologist, which is different. An endocrine surgeon is different from an endocrinologist. Endocrine surgeons just do the surgery, okay? Mine followed me, and she did ultrasounds every 6 months as well. But they do not deal with your levels and things like that. That is an endocrinologist. They are 2 different people, and you're going to deal with both. So an endocrinologist is going to follow you after your thyroidectomy, and they will follow you the rest of your life. So my endocrinologist said Synthroid was the golden standard, and that is what I was going to stay on. And honestly, I've done really well on it. I know everybody's different, but I've never had any problems. I never dealt with weight gain, hair loss, anything like that. And they got my levels under control pretty quickly. I know pregnancy is a big question for people. I had both my children after thyroid cancer, after my thyroid was gone. So I had no problems getting pregnant. Like I said, they got my levels under control pretty quickly. One thing I will say is that if you're pregnant and you don't have a thyroid, you need monthly levels checked. So you're going to have blood draws like every 4 to 6 weeks. You're going to have a lot more blood work than your average pregnant woman, because they're going to need to keep increasing your levels. So I think when I was pregnant with Pearson, I started out on 120 mcgs of Synthroid. By the time I was ready to deliver, I was taking 175. So your body is needing more and more of those hormones. So it's really important to, you know, communicate with your OB if you are planning to have children, and communicate with your endocrinologist. They both should be keeping track of you during your pregnancy and making sure that your levels are good and that, you know, you have the proper increases in your doses. What else can I tell you? Just really important to be your own advocate, and if something doesn't feel right in your body, you know, talk to your doctors and tell them. My symptoms, everyone has different symptoms. I had pain in my neck. I had persistent sore throats. I kept getting sick. My body was out of whack. Hormonally, I knew something wasn't right. And I was super tired. Thyroid was removed. That all really balanced out. The other thing I want to talk about, if you do feel something and, you know, you're thinking about putting it off, listen, I had these symptoms for a year. Something that it has a high cure rate. And the sooner that you go, I was stage 1, but it had still spread. The sooner that you go, the easier it is to take care of. So, for example, maybe if I had gone or been able to figure out and get a diagnosis sooner, I might have been able to avoid radiation. So because it had spread to lymph nodes, I had to have something called radioactive iodine, and that is it was a terrifying experience for me because you can't be with anyone. So you have to be isolated. I think I was isolated for 2 weeks. And you go in to nuclear medicine, you take a radioactive pill, and then you have to isolate for 2 weeks by yourself. And I was nauseous and I was sick and I couldn't be with anyone. I couldn't even be with my dogs. So like I said, if maybe I had caught it in the beginning and it had not spread, I could have had my surgery and been done, and that would have been amazing. But I had to have radiation because it had spread locally and they needed to make sure it wasn't spreading throughout my body. So the radioactive iodine kind of will attack anywhere it's been. If there's any remaining thyroid cancer cells anywhere there, it just annihilates them. And unfortunately, I got many opinions before I took it, but everyone said, like, you have to have it. So unfortunately, I had to have the radiation. But this is why it's important. If you're feeling these symptoms, if there's a lump, please get it checked out. And don't, like I said, don't panic, but just be proactive about this and about your health. For this, if you're a caregiver or if you are going through this yourself, survivor stories, read them, share them, connect with other survivors. I feel like that kept me really positive throughout the whole experience, was hearing people who have been through it and are living healthy lives now. Stay out of the doom and gloom. It doesn't help, okay? So just positive stories, survivor stories, talking to other people who have been through this. It was a huge help for me, and I think it really helps anyone with any type of disease. Hearing the stories of people who have overcome them is one of the best things you can do. Stay out of the doom and gloom and stay positive.